a conversation that I've been wanting to have since late last week. It was the announcement, the reports of a young dedicated doctor at the Prince Mshiyeni Memorial Hospital. It's in Umlazi in Durban. Dr. Ululuto Mazwi, passing away while on duty, diabetic, but was ill, but was allegedly forced to return to work, dying on duty despite reportings of his ill health. Apparently, the supervisor in that case has been suspended pending investigation. But it's not just the death of Dr. Mazwi. Over the last week, you had 4 medical officers in KZN alone passing away. The KZN Health Department expressing devastation and announcing internal investigations. Since these have been reported, you have had many doctors and healthcare practitioners turning to social media, expressing sentiments of extreme workloads, 24-hour shifts, often scheduled back to back, and the pressure to work even while unwell and exhausted. What has been described in Dr. Mazwi's death is that some doctors are even sicker than their patients. Joining me now is Dr. Nkateko Mnisi, who is of the South African Medical Association Trade Union. Good morning, Dr. Mnisi. Really appreciate your time. How common is the culture of overwork and then also silence among junior medical staff, particularly the medical interns?
Good morning, Lester, and all the listeners here today. First and foremost, we'd like to thank you for having us here today. We'd also like to extend our sincere condolences to the family of Dr. Mazwi and also all other affected families in these particular issues. The issue you bring is one of great concern and of importance. Lester, I'm not quite sure where to begin. But as you said, I'm the first deputy president of SAMATU, so I don't only speak for myself, but I speak of thousands of doctors throughout the country. When we say that it is indeed very sad time currently for the medical fraternity at this point. So just to put your listeners on par, we have, after finishing medical school, you must complete 2 years of internship, followed by a year of community service. And those are normally the years in which we consider you a junior doctor. It may extend further than that, but those are the general terms. And in internship, it's a 2-year program which is enlisted with different blocks or different specialities in medicine that you have to go through. And in each of those blocks, you need to be signed off by the head of department, head of unit, or your supervisor to say you've done a good job. So this indeed is part of our training. But as you have said, there seem to be reports where abuse and bullying have been happening in the workplace. And indeed, we have spoken on about it on many occasions, but in this particular occasion, it becomes more painful because a life has been lost.
Dr. Mazwi, who passed away in Umlazi, did have an underlying medical condition. But talk to me a little bit about the culture of having to silence yourself when reporting ill, when you are feeling ill, saying the pressure not to say no to do another shift, to continue with doing rounds, even though you may not be physically capacitated to do so.
Okay. As we know, in the healthcare sector, we do quite an important job which has to do with saving lives. So even this hierarchy of medicine happens not only in the workplace, but even as a student, where there's a clear hierarchy that may happen and sometimes does, in some cases, also result in abuse. You know, there are multiple memes and jokes that are made on social media with underlying truths where people say your biggest fear as a healthcare professional is to send a message in and tell your colleagues you're not feeling well, you can't make it to work. You know, we laugh about it, but it's the reality. I think a few months ago, we highlighted the fact of the pressures of unemployment and also understaffing in our healthcare professions. So when you have that understaffing that exists, already you feel as if you're giving an extra burden to those you're working with. But also, you also want to, how do I say? We also want to have favor with those that are our supervisors when you think about possible job opportunities in future, but also the fact that you need signing off as junior doctors for particular blocks from your supervisors. So those are also things that also add on. So firstly, it's thinking about the workload that will be left behind for those that are there. Also wanting to make sure that your patients get the best. I think a lot of us that are in the healthcare profession do care about the community in which we serve.
Yeah.
So
So,
these are
so,
some of
so,
the
so
things
there's
that
also the pressure if you do have a particular patient that you may have a concern about, you maybe not be feeling well. There's the personal pressure. Let's set aside the professional pressure, maybe from superiors, but there's also the personal pressure. Says, I want to go back on rounds to make sure that that person who was admitted at the weekend, I want to be there when they're able to be discharged.
Yes, I mean, definitely we form connections with some of our patients. And the reality is sometimes when we're even on off duty, we sometimes call a colleague and say, how's Nkateko in bed number 4 doing? Is she doing better? I admitted her yesterday, These are some of the empathies that we have as healthcare professionals. But what can be a detriment, I think, which is what we're pointing out to, sometimes the carer is not taking care of themselves as much because of all these pressures that exist. And sometimes we do take our own health care as a back burner. And really, I do urge health professionals, I mean, including myself and all those that I know, that at times we really need to take care of our health, not only physically, but also mentally. Because how do we give the best of ourselves in these situations, if not? Also taking into account this month is Mental Health Month.
Yeah.
I think that's why I also just wanted to highlight that to the listeners that are here today.
We've often spoken to healthcare professionals talking about the various types of fatigue, the physical fatigue, the mental fatigue, even the compassion fatigue when you're dealing daily with cases of trauma. You're working in a system that is not operating optimally. There is a level of compassion fatigue. But at the end of the day, it comes down to an economy that's not growing, an economy where your future post your internship process is uncertain. So young doctors are working themselves to the bone now so that they can rise to the top, they can be spotted, they can maybe ingratiate themselves with superiors so that when it comes to getting a job in this economy, once the internship process is done, you're really working hard for that process, aren't you?
I think that's definitely part of it, but I think this incident that has happened and many of those that have been brought up are also a time for us in the healthcare fraternity to really reflect on the way we do things, on the way that we treat our juniors. I mean, just because something is a hierarchical culture that may be somewhat embedded in the thread of what we do or in the thread of things, it doesn't mean it's correct. Is it correct for someone? I know currently investigations are underway and they will continue. But if the allegations are correct that someone was coerced into going to work despite expressing the feeling of not being well physically and having a newly diagnosed chronic disease, we need to really reflect on ourselves. I know for us in the healthcare fraternity, but I think for everybody in all healthcare places or in all workplaces, how we treat each other also really does affect the future. And we need to be cognizant of identifying toxic work environments and toxic behaviors we may have, because if we don't identify them and acknowledge them, we won't be able to deal with them, and they just become the elephant in the room. And indeed, some people end up, inverted commas, dying in silence.
Yeah, very quickly on the idea of a hierarchical structure where bullying may be part. I know people who are healthcare professionals. I know people who have been in theatre with doctors with a certain bravado. I know of people who have had to interact with chief nurses, matrons in a ward. Just talk to me a little bit about that culture that may not be pervasive in all parts of our healthcare system, but maybe at some hospitals and some facilities, in how senior staff, senior doctors, senior nurses maybe treat subordinates.
So I think, as I've explained, we represent doctors throughout the country, and we do get complaints here and there regarding bullying in the workplaces. each complaint is unique and different. But what I'm saying is the fact that there are those that do feel bullied in workplaces. It's also for time for us to reflect on those matters, because it cannot be correct that we find ourselves having this case of Dr. Mazi if allegations are correct. And it's also important that we prevent them. So I think for us as a trade union, taking into account and really being the voice for doctors in the workplace, we are here to represent them, but we are also here to ensure their workplaces are of a sound value in order for them to be able to give the best healthcare to the communities. Because even for us, we truly do believe quality healthcare for all is something of great importance. And if the healthcare worker is not well taken care of, and their needs well catered to, that also becomes something that's difficult to ensure for the nation.
Dr. Nkateko Mnisi of the South African Medical Association Trade Union.